Thank you so much for joining us and welcome to today's webinar. So you're here for Psychedelics 101, Understanding the Basics and the Buzz. So I'm Alicia Coffey, the Vice President of States Advocacy, and I'll be moderating today's sessions. I have a few housekeeping notes for everyone before we get started. So first, this webinar is being recorded, and we'll email out the link to all the registrations within about a week. Right now, we are not offering CEUs, but if you would like a certificate of attendance, we can absolutely do that for you. We have a form for you to request that certificate, and we'll post a link to that form in the chat in just a little bit. It'll also be included in the follow-up email as well. So we have a lot to pack in today, and we might have some time for questions at the end of our session. So please feel free to put those questions in the chat. We'll be collecting them and reviewing some of them, and hopefully we'll be able to review and check in on those at the end. So put those in the chat at any point because we have a great tech team tracking that. So we have purposely titled this Psychedelics 101 because today is an introduction, and it's designed to inform the curious mind about what psychedelic therapy is and how it can be used for treating mental health conditions and what the future looks like for psychedelic treatment. So as psychedelic treatment practice and policies grow, Mental Health America will make sure that we keep the information flowing, so stay tuned for future learning opportunities. To set some groundwork, the treatments we're talking about are psychedelics with promising potential for treating mental health conditions. And those include DMT, MDMA, psilocybin, ketamine, and LSD. Now, here's an important reminder. Right now, the federal government, the FDA, and the DEA have classified psychedelics as Schedule I controlled substances. So at this time, they are not legal outside of clinical trials in the United States and therapeutic settings. Now, there are a few states that have legalized psychedelics for the therapeutic purposes and supervised adult use. Narrow, right? Therapeutic purposes and supervised adult use. Those states are putting policies in place to guide the work of practitioners, ensure the safety of patients, and the effectiveness of these medications. Now, these are all ideas that we're going to touch on today because we are joined by three incredible individuals who are going to provide you with more knowledge on psychedelics. So I'd like to introduce you to Sarah Norman, who is the Executive Director of Brain Futures, Sierra Carter, who's the Associate Professor of Psychology at the University of Georgia, a clinical research scientist in racial health disparities and promotion of health equity, and also Danielle Schlosser, Chief Innovative Officer and co-founder of Empathic. So welcome, everyone. We are thrilled to have you joining us today. And I'd love to start by having each of you introduce yourself and take a few minutes to tell us about the work you're doing in this space. Sierra, will you start us off?
Yes, happy to. And thank you so much for inviting me to this space. I'll be quick because I know we have a number of other experts in the room in this space. I come to this space kind of non-traditionally. As Alicia mentioned, one of the things that I really focus on is health equity and health disparities. And my work, really simply put, is I want Black people to live long lives. And whatever we have to do that, I want to support that. And so I research a lot about how chronic stress from racism, traumatic stressors, across the lifespan for marginalized people, but particularly Black people, can have an effect on the mind and the body. And then I think about prevention-oriented treatments that are culturally influenced that can offset the toll of chronic stress to lead to longer lives for Black people that they deserve. And so I've been doing that work for over 15 years, really trying to understand ways in which we can increase longevity as well as functional longevity. So not just living longer, but feeling well while you're living. And so how I came into this space was actually a question asked by my colleague, Dr. Jessica Maples Keller, when we were working together in Atlanta, Georgia, where we are, about chronic depression and severe depression that we were seeing, particularly, and also severe PTSD that wasn't getting better by traditional methods. And she asked me a simple question. She was like, would you be interested in some cutting edge thoughts on like what actually might solve that? And I was like, what are you talking about? And she was like, oh, psychedelics is getting an uptick in interest, but we don't have a lot of Black people in clinical trials. And it would be interesting if you would just sit and, in and understand some of the work that we're doing. And so when we were having discussions, I was sitting in on some of the discussions with other researchers in the space, and those who are conducting clinical trials. One of the things that stood out to me is I was like, oh, have we asked a lot of Black people how they feel about psychedelics? And so one of the things that me and Dr. Jessica Maple Colors did is we did two kind of big studies for us, both quantitatively. So we're asking, doing surveys, both broadly, nationally, with about 294 people about their perceptions of psychedelic treatments and psychedelic assisted therapy. And then we also kind of came home to our home base with Black people living in Atlanta, and we did 4 focus groups, 2 to 3 hours, just really trying to understand how they felt while we provided psychoeducation about what psychedelic assisted therapy would look like. So I'll tell you just briefly what some of those findings were, because I think they're important to this future conversation that we're having, is that with the quantitative studies, we did that with 294 Black and white individuals, and we provided psychoeducation, so what it's about, what psychedelic assisted therapy is. And before we provided that, we asked them would they be interested. And generally, what we found was that both Black and white people were generally similarly interested. But when we provided psychoeducation, particularly Black individuals who had severe depression were more interested in psychedelic assisted therapy than white individuals. And what that told us is that it's not necessarily all about Black people not wanting this or hesitant, all about mistrust. That's a part of the story. But a bigger part of the story might be that there are structural implications in how we come and provide information to Black communities, Black people, that if we do it the right way, if we provide the best systematic practices, that we could actually have those highly interested Black individuals be really invested in the future of this psychedelic work. And similarly, when we did the qualitative focus groups, what we also found is when we first walk in, we ask everybody, how are you feeling about psychedelic assisted therapy? Do you know about it? No. What do you think about it? And everybody was like, I wouldn't do that. No, no, everybody was a no, pretty much. And then after we did psychoeducation, we provided information about what the treatment would look like in clinical trials. The 100% of people were on board. And so we do think that there's a lot of discussion around like what hesitation looks like, which is really important. But I think one of the big components that I took away, particularly getting to hear Black people talk through what they would want to see in psychedelic assisted therapies, is they like the engagement of information giving without judgment. They liked the ability to ask questions at any point during the process. They gave us suggestions about ways in which we could increase accessibility, which included transportation costs with these clinical trials, childcare, ways in which we know in our history in the United States in particular around drug laws as well as stop and frisk laws, particularly targeted at Black individuals, that they wanted knowledge about what legal concourse they would have if things occurred while they were a part of a clinical trial. And this information was really important for us to kind of think about logistically, how we can break down some of these systematic barriers to increase the number of Black individuals who are in these clinical trials because they are interested in it. And so I came into this work kind of just curious. And now, as someone who is all about making things that people want and deserve, particularly Black individuals, making things accessible to them, I have found that this type of treatment, if this is what the people want, I want to make sure they have accessibility to it. So I kind of came in from this back kind of viewing, and now I see myself in the space making sure that people have access to the things that they deserve. I'll stop there.
Thank you so much, Sierra. Really appreciate it. Sarah, would you like to introduce yourself?
Sure, it's a real pleasure to be here today. Dr. Carter, Alicia, Dr. Schlosser, I'm honored to be here with you today, and everyone on the call. So thank you for having me here. My name is Sarah Norman. I'm Executive Director of Brain Futures. And we are really trying to, I'm trying to learn how to do the clicking from my perspective. Sorry, guys. Let me just tell you a little bit about Brain Futures. It's a nonpartisan, nonprofit, community-based oriented organization that really wants to bring innovative, evidence-based interventions that improve brain health and well-being to whoever needs it, wants it, and can benefit from it. And so we're really out there trying to bridge research to practice, because the evidence is out there. There's promising new interventions, but they often don't make it to people's bedsides or their houses, wherever they are, for 17 years. We've done work on youth executive function. We've done work on neuromodulation. We've done work on mental health parity. And psychedelic medicine came out as something where we wanted to make sure that after FDA approval, those who could benefit could get access. As a I really am struggling with clicking. Thank you for bearing with me. So why and what are we doing about the future of psychedelic therapy? It's the clinical trials have suggested that it is a tremendous opportunity around both mental health and recovery. And I think as we look at the number of clinical trials out there and where the FDA is on reviewing it, the question of FDA approval for a variety of psychedelic medicines is not if it's going to be approved, but when. And so as we get ready for approval, we want infrastructure to be present so that you're not waiting till afterwards to go from 0 to 60 or 0 to 100 miles per hour. And Brain Futures is working with folks across the nation to really lay down that infrastructure so that it is accessible, as Dr. Carter pointed out. So what are all the things that are going to influence health system adoption? It's the same thing as anything new. FDA approval, provider adoption, clinical outcomes, access, insurance reimbursement, cost effectiveness, patient safety, patient preferences. All these things are incredibly important as we move forward. And so Brain Futures has been working with clinicians and consumers to build sort of all the infrastructure that are needed to roll this out in a safe way, in an accessible way. One of the first things we worked on was professional practice guidelines. And we worked with clinicians, interdisciplinary clinicians, from social workers to psychiatrists to psychologists to peers, to really put together what are the guidelines necessary that will allow psychedelics to be safely available. And so that touched on everything from healthcare licensure to informed consent. What does informed consent look like in this space? What does a therapy look like in this space? What does screening look like in this space? Who can, who can't? What are the risks that need to be managed? What does a safe administration look like? And so that was sort of one of the steps forward, so that when FDA moves forward on approval, which is anticipated, sooner rather than later, we have sort of the standards necessary to support safe therapeutic dispensation. Another sort of set of conversations we had with practitioners was asking, okay, let's go a little bit beyond just what the evidence base is saying. What are you saying? You're involved in clinical trials. What can you tell us about best practices in sort of the operation? And so that went through some of the same issues, but one of the things that came out and that was supported was a concept called set and setting. And we all know in the healthcare space that sort of the space that you're in, both mentally, emotionally, but also physically, influences the outcomes. It's particularly important for psychedelics. So what is that set? What is that setting that we need to have? And I'm sure Dr. Carter and Dr. Schlosser will share more about that as well. Another set of sort of issues that we dug into was informed consent. One of the things that we want to make sure is that patients should feel empowered to revoke consent at any time. Psychedelics have a longer sort of session than traditional medications, and so you have to think about consent differently. The critical question, access. We all know that unfortunately there are significant barriers around access for all mental health and substance use disorder treatments. And so one of the things we've been working on really hard is making sure that when FDA issues approval, that there's access. And so much of that is determined by whether or not people can get reimbursement, whether there's coverage. And an unusual or sort of unique issue in psychedelics is that unlike typical therapy sessions, or a traditional antidepressant where you get it for one pill a day, you have longer dosing sessions, which could take up to 8 hours. And so there's no existing coverage models that really work well. And so what we're trying to do is say, okay, healthcare providers, here's how you can use the existing coding to make sure that it's accessible. Here's how we can work with payers across the system to make sure that it's accessible to everyone who needs it and can benefit with it. So I know that Mental Health America is a real leader in the advocacy and policy space. Brain Futures has also been working in this space to make sure that our friends in the government are ready for approval, and supportive in that space. We just had, for example, a congressional briefing in collaboration with the Bipartisan Addiction Treatment and Recovery Caucus, which went through all the evidence base that's being constructed around psychedelics and addiction. And so we are getting asked from members of Congress, from agency officials, how can we build that on-ramp to facilitate safe, widespread clinical access to psychedelics? And so certainly, many of you on the call have, incredible ideas about that space. And what we've been sharing is that there has to be ongoing investment in the research, but also we have to support providers to get into the space, make sure that the care models are designed in the best possible way, that there's sustainable reimbursement and broad stakeholder and consumer engagement. That's the message we've been bringing, but we welcome, tell me how to make that message and that work better. So that's some of the work that Brain Futures has been doing. It's really a pleasure to be here today. If you want a QR code to find all our resources, it's there. And I was going to say, turn it over to Dr. Schlosser, but maybe I turn it over to Alicia.
Thank you so much, Sarah. Appreciate it. And you're right. Dr. Schlosser is next. Danielle, please jump in.
Yeah, thank you so much. It's great to be on this panel with such a fantastic crew. I'll keep my intro brief since I know we have some great questions ahead. But a little bit about me, I'm a licensed clinical psychologist, and I'm also the co-founder of Empathic. What we do at our company is we work with a lot of the people developing these psychedelic drugs to be approved, hopefully, for folks who are interested in getting help for their mental health and well-being. As a part of these clinical trials, quality and safety is of critical importance. And so what we do with some of the sponsors who are developing these drugs is we help to record the support sessions and the drug dosing sessions and ensure that those are being done at adhering to a specific protocol safely. And we do that using our AI platform. And so we look at, for instance, is the education about the study drug done correctly? Are support strategies done ethically? And are there any clinical risk issues that need to be handled? This is really important because, as you've heard a little bit about the psychedelic compounds specifically, they're very different than SSRIs or other medications we see to treat mental health conditions. These are experiential drugs. So people have pretty profound alterations to their thoughts, feelings, and their perceptions of experience. And so it's really important that the support they get from their healthcare provider is done correctly and that people feel really safe in that experience. So, that's some of the work we're doing. We're also hoping to help if and when these drugs are approved with the rollout and ensuring that the care that's being delivered is done well. So I know you have more questions about what we do, so I'm just going to pause there.
Oh, yeah, we've got a ton of questions coming. Thank you so much, Danielle.
Yeah.
I think it's really obvious from hearing all three of you introduce yourselves that we have a font of knowledge here. We're very fortunate to have all three of you in the room. And so I'm just going to leap right into some questions. So we'd like to start with some basics. So for someone curious about psychedelic treatment, what can that process look like and what benefits come along with that, specific to mental health conditions? And I'd like to address that to you, Danielle.
Yeah, thank you. So right now, what the model of care, I was hinting at this in my intro, is different than going to a psychiatrist and getting a prescription for an SSRI, for instance. What this looks like, or what, again, this is just in clinical trials, but what we anticipate this looking like upon approval is that people will go through an informed consent process where they understand, what will this experience be like? There will be preparation sessions, at least one, I would imagine. Although some of these drug sponsors are having up to 3 before the drug dosing session. And those are really focused on educating the educating the patient about what to expect in that experience. And there's a wide range. Sometimes it can be difficult to predict what the experience may be. And some people can feel these drugs very strongly in their body, and that might be a surprise. They may think, oh, this is just going to alter my thoughts. But what a lot of people may not realize is the physical effects. So there's a lot of education about what to expect. There's also, you come up with like a game plan for support. So during the experience, because there's a range of experiences, some which can be really positive, euphoric, while others can be challenging. And so part of making sure somebody feels safe is helping come up with a strategy for support that they can get from the provider, and then also maybe they can do for themselves. And then you have the dosing session, which Alicia mentioned there are a number of compounds that are going through, the drug pipelines. And so some are shorter acting, like DMT, where it can be about a 2-hour session. And then you have some like psilocybin and LSD, and that can be 6 to 8 hours. And so during that session, usually a clinician is there the entire time to offer support as needed. If it's MDMA, sometimes there is therapy delivered during the drug experience. And then after the drug dosing session, there's usually post-dosing sessions. These are sometimes called integration sessions, where you're reflecting on what was that experience like, what were some of the insights I may have had, and then you talk about how you want to carry that forward. It's likely that the model will be anywhere from doing this once to potentially 3 times a year. It's unclear right now. What we do know, some of the state of the evidence, is that these drugs do appear to help, certainly in the short term. There's questions about durability. How long are the effects? Is it 30 days? Is it 3 months, 6 months? So we don't have the evidence fully fleshed out for that right now. But we definitely know that these are large doses that are not intended to be used every day, and it's an intermittent type of treatment. And I would say the indications that they're investigating right now typically are depression, PTSD. There was a recent study on postpartum depression, which was really encouraging. That was a phase 2 trial. And then certainly some addiction disorders. But I would say depression is the most common therapeutic area that these folks are focused on, and I guess PTSD.
Thank you so much, Danielle. Appreciate that.
Yeah, no problem.
Yeah. So you were talking about clinical trials, and I'd love to hear about some of the evidence and the strength of that evidence that psychedelics can help treat mental health conditions. Danielle, I know you have insight, and I think Sarah does as well. So
Yeah, let's say a little more. So right now we have MDMA and psilocybin kind of closest to approval. There's others that are, following along. The, MDMA studies were very persuasive. There were very strong findings. However, that drug was not approved recently by the FDA, and the control response letter was published. There were some concerns that the positive effects, weren't fully evaluated. So the full safety profile still needs to be investigated further, but it certainly does seem to have some therapeutic benefit for people with PTSD. And psilocybin, you're seeing some benefit for people with treatment-resistant depression. So these are people who failed at least 2 courses of the first-line treatments. That's a very difficult to treat population. It's not your standard depression population. So it's great that we're even seeing some therapeutic benefit for those individuals. Sarah, go ahead if you have more you want to add there.
Yeah, thank you. I mean, I think you did an excellent job, Dr. Schlesser, and I was trying to think of sort of filling in some additional things. I think one thing I would add to it is there's promising results around anxiety disorder as well. Dr. Schlosser was right in focusing on there's more phase 3 clinical trials around PTSD, major depression, and also treatment refractory depression. But sort of coming up in terms of phase 2 clinical trials and phase 3 clinical trials in progress, generalized anxiety disorder is also, really promising, and I think deserves some attention. There were some recent phase 2 clinical results around where there was duration up to 12 weeks, which is really wonderful because there hasn't been a new treatment approved for anxiety in 19 years, but who's counting? There is also I would say, a very promising set of research around substance use disorder, including alcohol, opioid, and smoking cessation. Unfortunately, there's more phase 2 clinical trials in that space than phase 3. So certainly that's an area where additional investment is needed. That being said, some of those results are extremely promising. So, sort of think about it, this is potentially a tiered rollout in terms of what it's able to treat and where the strength of the evidence has sort of accumulated the greatest. I think the other thing is I noticed in chat people talking about ketamine. And I realize we haven't talked about that as much. Some people consider that to be psychedelic adjacent or not. It is it's probably actually the best studied of all the compounds. And there is an indication that has been approved, esketamine through Spravato, that is available and approved by the FDA. Depression is the area. So just to add, I'm trying to think of what else did we miss, Dr. Carter, in reviewing the strength of the evidence.
No, I mean, this is very thorough and thoughtful. I think kind of from the cultural lens that I usually take, one of the things that I think about just kind of amplifying the voices from our focus groups is trust, autonomy, and choice. I think Dr. Schlosser was talking a lot about safety. And one of the things that they talked about was they want to know upfront all the things that are happening. And I think one of the things that is done well in these treatments is providing a lot of information. And I think one of the things that they would have liked to see that we haven't, I think this is when FDA approval happens. I think maybe other people in the room might like this too, is they would like people to come to them rather than having to come to a source to talk through what this treatment would look like. And I think like right now we're getting all this information, and I think this is a beautiful space to be in, but not everybody has access to this type of information. And I think for a lot of people, it's like, oh, like this would be it. Like I would love if someone who is Black or brown were telling me this story or telling me this information, because that will increase my thoughts on like, how much, autonomy do I have in these therapy sessions to make decisions? I think Dr. Schlosser was talking about how this inner experience, openness to inner experiences, one of the things that we know from MDMA studies with racial trauma in clinical trials that Dr. Monica Williams was a part of, was that people were talking about intense experiences of seeing their ancestors. That was also like a part of kind of their revolutionary journey for Black people experiencing racial trauma that isn't traditionally talked about in kind of the clinical trials evidence. And so even with PTSD as a treatment, there are nuances to what people might discover based on culture and race and ethnicity in those types of experiences that we're also noticing in the clinical trials that leads to healing. And I think that's also really interesting. And I think people will be interested to see more information about just the different types of experiences that people have when they're in psychedelic assisted therapy. And that research is actually coming out a lot. And I think it's really interesting, both qualitatively and quantitatively, about just the richness of those experiences, especially when we think about indigenous medicines that were rooted in psychedelics, right? So I think a lot of indigenous people were saying, this psychedelic movement was kind of, something that we had all along. Like this was at the root of who we were, and then it was illegal. And so I think some of this conversation has been, at least in the spaces I have been in, has been like a taking back of things that were ours and how we can do that when it becomes a treatment and how we can do that safely. And I think that's another conversation I think that's continuing to happen in this space for those who are interested.
Wow. Thank you so much for grounding us and reminding us about how important it is, not only these clinical, scientific, how does this as a medicine work, but also how do we create practices around this medicine that are culturally appropriate and increase access as we are offering people access to their own cultural magic. This is a fantastic conversation, folks. I am thrilled. I'm also curious, again, thinking about some of that safety pieces. We know that beyond the science of the medicine, there is also this idea that psychedelic assisted therapy is recommended with a support, with a therapeutic support, as opposed to taking psychedelics on our own. And I know that culturally, like it has been a community, a process that you are not on your own. Um, can we talk a little bit about why that is the suggestion that it be taken in a collective or with trained assistants? Why is that becoming best practices? And that's open to whomever would like to weigh in.
I could talk a bit about that. So I think I mentioned this before. What's unique about psychedelics is the extent to which it influences your perceptions and thoughts and feelings and the physical effects. So a lot of times these are not, well, they're not ordinary experiences. They're not your everyday. And they really can make someone feel vulnerable, exposed. It can be nerve-wracking or scary to have such a big change. And so and also if you think about somebody who is struggling with their mental health, so they may not be fully resourced with all their coping strategies. So, you have the drug and the nature of, the mental health of status of the person who's about to go into the experience. And because in a lot of the trials, we're also seeing a lot of people who've never taken a psychedelic, and the majority of people actually have not taken a psychedelic. So um, you really want to help somebody feel prepared going into the experience. We also think that if you feel prepared and you're thoughtful about, what do I want to get out of this experience, you are likely to feel safer on the day of. So even if you have a very powerful experience where you have this alteration in your state of consciousness, if you feel safe, what people report qualitatively is that they feel like they can get more out of the experience. I can explore more easily. I can ground into the experience. I don't resist the experience as much. And so certainly, more of the research has been done in medical settings, but I would say most likely in ceremonial settings that people are also feeling a sense of safety and community there. And so that certainly helps. I will also say it's really important to have that integration period after the dosing session. And so for a lot of people, they have experiences that can be difficult to make sense of. And so having a safe space where you can work with a clinician who also knows not to direct you too much. Like you don't want someone to be like, oh, you had that experience. Well, that clearly means this, that, or the other. The idea with these compounds is a lot of times there's a philosophy around wanting to cultivate inner intelligence. So you want the person to think about what is the significance of my experience? What is the meaning I want to make from it? And the idea there is that you are building strength in that person, confidence in that person, that they have had a profound experience, they can make sense of it, and they can carry it forward, certainly with the support of a therapist as needed. But they have that inside of them. And for a lot of people who struggle with their mental health, they lose confidence that they can take care of themselves or that they can understand the world around them well. And so it can be really powerful, a powerful treatment. Um, I do also want to say it doesn't always work for everyone. So there's also a piece where if somebody doesn't have the experience they want to get out of it, it can be really demoralizing. There is a lot of hype around these drugs. A lot of people tell incredible stories. They're like, oh my God, sign me up. I want that experience. But not everybody is going to have that. And we honestly don't know why. We don't know why some people do and some people don't. So that's another reason where you want to give people support in a contained environment.
Thank you. I want to think a little bit further around this idea that it doesn't work for everyone. And sometimes that's a little mysterious. So I understand it might be challenging to say, what are some signs that point to this being, or a person being a good candidate for this therapy? Or the flip side, are there people who perhaps would want to be extra cautious, extra careful, ask extra questions before they would embark on this type of treatment?
I just want to say one thing. I'm sure Sarah or Dr. Carter have some insights. I would say we're still trying to investigate this. But from my clinical experience and what I've seen is if you are, a lot of times with these trials, people get off their medication. And it's to be determined what will be required out if and when these drugs get approved. But for a lot of people, or for some people, sorry, they get worse before going into the dosing session. And I would say if you want people to have some resources going into the experience, right? You want to be, I guess what we would say is, a mental health professional is like clinically stable. At least, it may be stably depressed, but it's not, but not significantly worsening. And that the person feels incredibly vulnerable going into the experience. I think that would be a red flag going into having a potentially because people can have challenging experiences that they later find to be therapeutic, but if you're in a state where you feel so awful, you may not be able to make therapeutic use of that challenging experience. But yeah, there could be others if you guys can think of them. That's one that comes top of mind.
Anyone?
Oh, I'm sorry.
No,
I wasn't sure who was talking. Sorry. One case that sort of has stuck with me as like, where psychedelics might be sort of perfect for the person. Just thinking about somebody who might have tried multiple SSRIs with that, major depressive disorder, tried multiple SRI. I don't know why I can't say SSRIs right now. And it hasn't helped, right? And they're looking at different options. Maybe there's somebody who has, struggled with weight gain as a result, or sexual dysfunction as a result. And I think one of the really promising things about psychedelics is that in general, the physiological side effects in general of psychedelics are generally less than a lot of other mental health treatments. We aren't seeing sexual dysfunction, we aren't seeing weight gain, et cetera. I mean, there's obviously, this is all compound specific, et cetera. But that is sort of a perfect case study for somebody who might want to try it as they've tried other SSRIs and want to step into it. Obviously, not FDA approved yet, but that would be sort of a good case to think about for somebody. And I think the side effect issue of current mental health treatments is something that definitely sort of adds to the value of psychedelics because of their positive safety profile in general, physiologically. Other things to add in this space.
Oh, go ahead, Sarah. I didn't mean to interrupt you. You can keep going.
No. I was turning to you, but then I was turning to the chat, so I wasn't sure.
Okay. Yeah, I was just gonna say agreed with your point about people who've experienced a lot of other medications. So that was something we also found in our focus group research was that the people who were in our focus groups are currently being treated at a public hospital. And one of the kind of, I wouldn't call it a selling point, but when we were providing psychoeducation about um, psychedelic assisted therapy, they were like, oh, like I get a therapist. I mean, it was kind of basic things. I've tried so many different medications that had a lot of side effects. I only get seen ever so often. I'm trying to change my medication, but I've been on this medication for so many years, and I'm continuously taking this medication that causes me a lot of different side effects. So there was a lot of discussion around the current state of our healthcare system and the problems with that. And so that was one of the things I also thought was interesting, just listening to the Black community in Atlanta, Georgia, was that for me at least, it was, yeah, psychedelic assisted therapy would be interesting, but also we have a lot of problems with our current healthcare system and how we treat that people were seeing that like the idea of having these safety practices in psychedelic assisted therapy were really important, as well as something that was not a long-standing drug that they had to take for their severe depression or severe PTSD with a lot of different side effects. So to just amplify that, it was a lot of people in our focus groups who definitely said, I like having another option and just another work that I'm having to do constantly and chronically that is not seemingly helpful in my recovery.
And the one thing I just noticed a question in the chat, which is a good addition to what we've said, is the most common exclusion criteria. Somebody asked about exclusion criteria in these clinical trials is schizophrenia. And so that's I would anticipate that would continue after it moves past FDA approval.
Thank you for that, Sarah. Wow. We have time for a few more questions, but I have to admit, like, I'm getting such incredible information from all three of you that there's a curiosity that is not on our list, and I would like to touch base with because of what I'm hearing live. So please bear with me as I formulate this. Um, Something I'm hearing is the major benefit of trying something different that has potentially fewer side effects. And we know that people don't want to stay on a medication, even though it helps their symptoms, if it creates bigger complications in the rest of their lives. A piece I heard from Danielle was that while psychedelics may not come with the side effects that we have come to kind of tolerate and accept in other medications, that sometimes this treatment can be challenging. And I heard Danielle talk about how just because there may be a challenging experience with this medication, it doesn't mean it's not therapeutic. And I thought that was really exciting. And I'm turning to Sierra with this because when you're informing the community about the risks and benefits of psychedelics, and I'm hearing buy-in related to education from the people who you've shared information with, how do you talk about that this might be a challenging treatment with really satisfying outcomes, really high therapeutic outcomes? Are you having those conversations, and what are people telling you?
Yes, that's such a good question. And I think a two-pronged answer is that I think one of the things me and my colleague talk a lot about is that solutions when it comes to thinking about the increased vulnerability that people are placing in the hands of therapists who are doing these clinical trials is that when you talk about vulnerability, there are some people who are more vulnerable than others, and it just happens to be in our US culture, and that can mean a number of things when having openness to discovery. And so one of the things that we talk to people about is how we as providers have to do a lot of work, as well as the practices that we're doing, and that we haven't all the way caught up to what the needs are as far as like vulnerability that can happen in those spaces. And so we're open and
Is it
honest about that, about like, because they ask questions like, who all gonna be in there, right? Who all gonna be in this space, right? And we tell them like it could be two white therapists. And one of the things we found in our focus groups is a number of people said it wasn't necessarily about race concordance. It had to be the same race, but there had to be the same vibe as our focus. So autonomy, choice, right? Ability to ask questions, ability to talk through the process, to talk about religion, right? Because there can be religious experiences. How down would a therapist be with that conversation? If it comes up that I'm seeing these things that are non-natural. And so a lot of our discussions with my colleague and others has been like, how do we shape this as it comes out to kind of fit the community that might experience vulnerability or has already experienced vulnerability in their treatments, and has had dissatisfactory reactions, knowing what Dr. Schlosser is saying, that it could have a lot of potential benefits if people are able to stick with it. But I think at the root, what we tend to say is like, we got to make it a space, and not to say that there aren't spaces that are already doing this, but we need to continue to work to make a space that people feel that they can be their vulnerable selves, and the ways in which they want to share, the ways in which they want to experience, the ways in which they want to be open. And that can come with a very culturally responsive lens.
Yes. Thank you so much. That was lovely. I appreciate that. Um, so friends, I'm watching the chat and I know you all are as well. There are incredible questions coming in. I want to remind folks that we're doing a 101 today. I can see lots of folks in the chat ready for deeper, more pointed conversations. And so my hope is that we will be able to continue supporting those conversations in the future. I'm also going to share all the questions in the chat with our experts, because if in fact on the back end they're able to address any of those before we send our follow-up email, we'll try to have that happen for you. So we are looking at the chat. One of the questions, I have this beautifully composed policy question for all of you, but I like what's in the chat better than what I have composed. And I'm just going to read it verbatim. I live in a red state that sees these substances as having absolutely no value. I'm hearing a lot of wonderful things today, but how do we fight the deep stigma associated with psychedelics? And I'm curious if we can talk about that from like a policy and advocacy perspective.
Sure. I'm actually very happy to talk about that. I think one of the interesting things about psychedelics is that both at the state level and the federal level, we have found more allies both on both sides of the aisle, which I know is unusual in this time, both in our work with members of Congress, and as we're looking at states. I'm not sure, for example, since you brought up the red state example, Texas recently passed a $50 million investment in ibogaine research. And so there's huge support that we're seeing, at least in some states that are led by Republican governors. Former Governor Rick Perry has been a huge supporter of ibogaine, in particular around substance use disorder. And I think the good news is that you can point to politicians on both sides of the aisle who are supporting psychedelics in different ways. So I could say much more about that, but I'm not sure if any of my fellow panelists want to weigh in.
Okay, thank you so much. I think we have time for just one more. Yeah, if we could hear a little bit about how currently mental health professionals are thinking about psychedelic treatment. Is this something that there's a lot of buy-in about? What kind of community education do professionals need?
Would be happy to answer that question. We recently did a survey of 363 academic clinicians, healthcare leaders, from social workers to psychiatrists to psychologists, pharmacists across the United States. We did this in partnership with NORC at the University of Chicago. And 79% agreed that psychedelics were promising. And so 80% are sort of are stepping into this space. They all did seem to say, or many said, that they needed more education in this space. Another way to get a handle of that is we did a survey of healthcare providers across, and we did it in 20 states. And we asked the question, once FDA approval is issued, are you ready? When will you be ready? Will you include psychedelics in the behavioral health services you provide? What are the biggest barriers, et cetera? I think what was really sort of promising / a little bit surprising to us was the majority said that they plan to include psychedelics within 6 months of FDA approval. Now, it's possible, this was a smaller survey, it's possible that this was more representative of folks who are already doing sort of other interventional psychiatry practices like ketamine or TMS. So we may not have, with this survey, have reached sort of deep into traditional sort of therapy providers, but at the same time, there's a big group of folks who are ready there. The challenges they outlined will not surprise you. It was reimbursement and training. And so certainly that is necessarily something that we're working on.
Wonderful, Sarah. Thank you so much. Friends, we are coming to the end of our time together. So I just want to say thank you so much. It's been a really rich conversation and so much knowledge has been shared today. We're grateful that our panelists were able to join us. We're thrilled we had such a robust and curious audience. So I just want to thank you all so much. Note the chat, friends. You are answering each other's questions. You are offering resources to each other. We will try to pull some of those out and include them in our follow-up email. I want to remind you that this was recorded, so this will be emailed out to everyone who registered within about a week. And I'm going to say thank you and good afternoon, and hope to see you again in a future session. Y'all have a great time. Great day.